In the medieval world, war was constant, brutal, and deeply personal. Soldiers faced not just the blade of an enemy, but the far more persistent threat of surviving without the knowledge, tools, or resources that modern medicine provides. There were no sterile bandages, no antibiotics, no hospitals equipped to treat trauma. The battlefield was only the beginning of a long and often deadly struggle to stay alive. Every wound was a gamble, every infection a test of endurance, and every recovery a product of improvisation, traditional knowledge, and sheer resilience. From crude amputations performed by barber surgeons to battlefield first aid using herbs and alcohol, medieval warriors had to rely on instinct, Akan's amputations, and the collective memory of their cultures. Disease, poor nutrition, psychological strain, and chronic injury followed them off the field and into camp, home, or monastery. Yet, despite the overwhelming odds, many did survive. Not because the system was efficient, but because the human body, when supported even by the simplest interventions, could sometimes do what no science at the time could. Their survival wasn't the result of medicine as we know it, but of adaptation, belief, community, and the hard-earned lessons of countless generations who fought and endured. Number 1. Battlefield trauma and immediate survival. In the thick of medieval warfare, the moment a soldier was struck by a weapon, whether it was a war hammer caving in a helmet, an arrow piercing deep into muscle, or a broadsword slicing through bone, there was no organized medical team rushing in. Immediate survival came down to instinct, desperation, and the help of nearby comrades. On the battlefield, time was measured not in minutes, but in heartbeats. If a man fell and his injury wasn't instantly fatal, the main priority became stopping the bleeding. Soldiers were not trained medics, but centuries of accumulated battlefield experience gave them certain habits. Rags torn from tunics, bits of leather straps, moss scraped from rocks, or even cold mud were pressed into open wounds to slow the flow of blood. These materials were anything but clean, but the concept of sterility didn't exist. The logic was simple: bleeding to death was a far greater immediate threat than infection a week later. Spiderwebs were among the stranger remedies, wound-packing material used across different regions. Though it was used more out of availability than science, it turns out spider silk contains mild antiseptic properties and helps blood clotting. That wasn't known at the time, but its effectiveness led to its continued use. If the wound was on a limb, belts or strips of cloth were quickly tied above the injury site to act as makeshift tourniquets. This crude method restricted blood flow, buying time for the wounded man to be dragged from the fight. But even this carried risk. Leave the tourniquet too long and the limb died. Remove it too soon and bleeding resumed. There was no manual for this, just gut decisions made in the chaos of clashing steel and screams. Once out of direct combat, survival depended on the terrain and who was nearby. Knights had squires or servants who could help them off the field, but common foot soldiers relied on brothers in arms or pure luck. If dragged behind the lines, a soldier might have his wound wrapped tighter with anything from linen to horsehair. Sometimes hot coals or irons were pressed into the wound to cauterize it right there in the field. The process was agonizing, often done without restraint or sedation, but if successful, it could seal blood vessels and prevent further hemorrhage. Yet this was only done when someone had both the tools and enough nerve to hold down a screaming man. In many cases, soldiers simply collapsed where they were hit, especially if their comrades were still fighting. After a battle, wounded men were often left where they fell until the battle ended or scavengers arrived. If they were lucky, friendly forces returned for them. If not, enemy looters might finish them off or leave them to die slowly. Some survivors managed to crawl to safety. Others bled out over hours, suffering in silence among corpses and trampled earth. Every injury was a gamble. There was no such thing as medical certainty, only the body's stubborn will to live in whatever crude aid was possible in the moment. Number 2, pain, amputations, and the limits of medieval surgery. In the brutal reality of medieval warfare, pain was not something to be treated, it was something to survive. There were no effective anesthetics as we understand them today. The pain of an injury, and especially of a medical procedure, was immediate, violent, and often overwhelming. For the vast majority of wounded soldiers, pain management relied entirely on crude improvisation. Alcohol, usually in the form of strong ale, mead, or wine, was the most accessible option and used more to sedate the senses than to actually dull pain. It was poured down the throat before procedures or directly into open wounds as a primitive disinfectant, although its effect on bacteria was minimal. In some regions, particularly where knowledge from the Islamic world or classical texts persisted, more potent substances like opium poppy extracts or mandrake root were used as sedatives. However, such remedies were rarely available to ordinary soldiers and were mostly reserved for wealthy knights or those treated in monasteries or by well-educated physicians. Amputation was one of the few surgical responses available for severe limb injuries, especially when a wound was caused by crushing force, such as from a mace, or a deep infected cut that had gone gangrenous. Soldiers whose legs were shattered beneath horses, or who took sword blows that splintered bones, often had no other option if they wanted to survive. The idea wasn't to repair the body, but to prevent rot from spreading. The people performing amputations were rarely formally trained surgeons. In most cases, these procedures were carried out by barber surgeons, a profession that combined grooming with basic medical tasks. Their tools, knives, saws, clamps, were used for multiple patients, often without any cleaning between uses. This wasn't due to carelessness, but because the concept of microbial infection didn't yet exist in European medical thinking. Before the limb was cut, a tourniquet would be tied above the wound to minimize blood loss. The surgeon would then slice through the skin and muscle quickly with a sharp blade before using a saw to remove the bone. Speed was critical. The longer the procedure took, the more likely the patient was to die from shock or hemorrhaging. After the limb was severed, a heated iron rod was pressed against the open stump to cauterize it and seal the blood vessels. The pain of cauterization was unbearable, and patients often lost consciousness, sometimes from the trauma alone. If they didn't die from the operation itself, the following days were just as dangerous. Infection set in quickly, especially with exposed tissue, and no real method for cleaning or dressing wounds effectively. Despite these risks, some soldiers did survive amputation, particularly younger men in strong physical condition with access to better food and post-operative care. Occasionally, monasteries provided more structured recovery, with herbal treatments, quiet environments, and basic wound management, increasing the odds of survival. Still, the majority of soldiers who underwent amputation either succumbed to infection or were left permanently disabled and unable to return to battle. The process was as much about cutting away death as it was about preserving life. Pain was never eliminated, only endured with gritted teeth and the faint hope of recovery. Number 3, infection without understanding germs. In the medieval era, the concept of infection was filtered through a framework of oral theory, spiritual beliefs, and direct observation, but without any understanding of microbes or bacteria. Soldiers and healers didn't know that invisible organisms caused wounds to fester. They simply knew that some injuries turned sour, that pus could smell foul, and that fever often followed even minor cuts. They described this not in scientific terms, but with words like corruption, putrefaction, or the imbalance of humors, especially excess black bile or phlegm. When a wound oozed green or yellow, or when the skin turned red and hot to the touch, they interpreted it as nature reacting to imbalance or as divine punishment for sin. The lack of germ theory didn't mean they did nothing, they just fought it in ways that made sense to them, often combining practical remedies with symbolic ritual. One of the most effective treatments used without them realizing its value was raw honey. Applied to open wounds, it acted both as a sealant and, coincidentally, a mild antimicrobial agent. In modern terms, honey's low pH, hydrogen peroxide content, and natural enzymes inhibit bacterial growth. But in medieval thought, honey was valued more for its symbolic purity and warmth. It was used in monasteries, on battlefields, and in peasant homes alike. Another widely used remedy was garlic, ground into a thick paste and applied directly to injured tissue. Sometimes it was mixed with wine or vinegar, substances thought to purify or draw out the evil. Vinegar, especially wine vinegar, was considered especially valuable for cleansing because of its sour, acidic nature. While they had no sterile instruments or knowledge of antiseptics, the acidic environment created by vinegar may have helped reduce some microbial presence, though inconsistently and without control. They also used clay, ash, and even animal fat mixed with herbs to make poultices. These poultices were applied to deep wounds or boils in an attempt to pull out the rot. The idea was that infection was something that needed to be expelled from the body. Sometimes this meant applying warm compresses to encourage pus to surface. Other times it meant lancing the wound open with a knife or heated iron to drain it. Again, with no real sanitation, often leading to more complications. These procedures were dangerous but common, and they reveal an intuitive, if imprecise, grasp of drainage and the importance of removing dead tissue. Abscesses were sometimes left to burst naturally or were punctured using sharp tools that had been used on multiple people. In most cases, there was no hand washing, no boiling of instruments, and little regard for recontamination. Though some religious orders promoted washing hands before care as a matter of spiritual cleanliness, herbal medicine filled the gap left by ignorance of microbiology. Monastic scriptoria across Europe preserved herbal texts like Physica by Hildegard of Bingen, or remnants of Roman works by Galen and Dioscorides, which included references to plants now known to have antibacterial properties. Yarrow was used to stop bleeding and promote healing, thyme for its cleansing effect, and sage to reduce inflammation. These herbs were gathered by monks, nuns, and village healers often applied in layered treatments where dried leaves were boiled, crushed, or steeped in oil. The knowledge wasn't centralized or systematized. Much of it passed orally, especially among women healers, midwives, and herbalists who operated outside of formal church-sanctioned medicine. During war campaigns, some women traveled with the army and provided unofficial care, blending folk knowledge with battlefield necessity. Their role was crucial, though often unrecognized in historical records. The fact that some soldiers survived horrific infections is a testament not to medieval medical science, but to the resilience of the human body, sheer luck, and occasional success from these rudimentary interventions. While many died from what today would be preventable complications, some lived long enough for their wounds to scar over. For every festering wound that ended in gangrene or death, there were a few that healed helped by herbs, time, or just a robust immune response. Their survival didn't come from understanding bacteria. It came from working around it with what they had, and relying on tradition, an intuition, and sometimes pure superstition. Number 4, surviving the camp, disease, diet, and filth. For medieval soldiers, the battlefield was only one threat. Often, what happened after the fighting ended posed an even greater risk. Military camps, especially during long campaigns or sieges, became dangerous environments where disease spread faster than any sword could strike. These temporary settlements, thrown together in open fields, forests, or near castles, were rarely organized with hygiene in mind. There were no latrines in the modern sense. The best a camp might have was a shallow pit dug into the ground for defecation, often used by hundreds and rarely relocated. Once the smell became unbearable or the area overflowed, soldiers simply used the woods, contaminating water sources nearby and contributing to the spread of fecal-borne illnesses. Dysentery was one of the most common and deadly diseases in military camps. Soldiers could go from healthy to dead in a matter of days, overwhelmed by dehydration and fever, with no way to replenish lost fluids or stop the bacterial onslaught. Bathing was infrequent, not always due to superstition as commonly misrepresented, but largely because there was neither time nor infrastructure. Cold weather, lack of clean water, and sheer exhaustion often meant men went weeks without removing their armor or boots. Their clothing, often soaked in sweat, blood, or rain, was worn day and night. Skin infections were widespread. Lice were ubiquitous, and not just a minor annoyance. They carried typhus, which could rip through a camp in days, especially in colder seasons when men slept closer together for warmth. Fleas, too, were constant companions. The presence of rodents in camps, feeding on discarded food and sleeping near the soldiers, increased the spread of various bacterial infections. The idea of contagion was vaguely understood. People often avoided the sick. But without any knowledge of transmission, it did little to prevent outbreaks. Food posed its own dangers. Soldiers lived primarily on preserved staples, salted pork or beef, hardtack bread, dried peas or beans, all difficult to digest and prone to spoilage. There was little chance of boiling or properly preparing food while on the move. Meat, especially, went bad quickly in warmer weather and could cause food poisoning, but hunger forced soldiers to eat it anyway. Fresh produce was rarely available. Supply trains were unreliable, and local peasants either fled or had already been raided. This absence of vitamins and minerals weakened immune systems over time. Scurvy was more often associated with sailors, but it wasn't unknown in land armies either, particularly during long sieges. Knights fared slightly better. They had squires to find food, boil water, and even prepare meals. But they were not immune. A contaminated stew pot didn't care about social rank. The drinking situation was just as grim. Natural water sources like rivers and streams were often used by entire units for both washing and drinking, usually upstream and downstream of waste pits. Unsurprisingly, this caused widespread bacterial contamination. Most soldiers preferred to drink ale or watered-down wine not for enjoyment, but because it was less likely to make them violently ill. Fermentation, though not scientifically understood, was known to produce safer beverages. Even children were given weak ale in peasant households, and soldiers followed the same logic in the field. However, during long campaigns, alcohol supplies ran low, and troops had no choice but to rely on whatever water they could find, stagnant pools, wells of unknown depth, or runoff from rain barrels. Medical care in camp was minimal. If a soldier got sick, he might be bled using leeches or blades under the belief that illness came from unbalanced humors. This sometimes caused more harm than help. Recovery was often a private matter. If you were strong enough to survive the fever, you lived. If not, your body was burned or buried in a mass grave with dozens of others. In the best cases, a monk or healer might offer herbal teas or poultices, but that level of care was rare and usually reserved for officers. For most soldiers, the camp was a waiting game of exhaustion, infection, and malnutrition. The wounded who escaped the blade on the battlefield now had to survive a different kind of war, one waged in the dirt, in silence, and usually alone. Number 5. Psychological resilience and the human cost. Medieval warfare left behind more than scarred bodies. It created invisible wounds that most never spoke of, and even fewer understood. The psychological toll on soldiers in the Middle Ages was immense, though it had no vocabulary at the time. There was no concept of post-traumatic stress disorder, but the behaviors and symptoms were there. Men who had fought in campaigns like the 100 Years' War or the Crusades often returned home quiet, withdrawn, or volatile. Chronic sleeplessness, nervous outbursts, moments of blank staring, these were common. Some knights were said to walk alone for hours, mumbling prayers under their breath or waking in the night screaming. Chronic anxiety and sudden aggression were treated either as signs of sin or possession, but to the men who lived through dozens of battles, it was simply what happened when you survived too much. The coping mechanisms soldiers developed weren't the result of formal treatment, but survival strategies shaped by necessity, culture, and belief. Many adopted fatalism, an unwavering acceptance that death could arrive at any moment and that everything that happened was God's will. This way of thinking provided emotional insulation. If you convinced yourself that each death was preordained, you could keep moving forward. Religious faith offered structure, ritual, and the promise of forgiveness, which gave many soldiers a path to reconcile with their violent actions. Some even sought out monasteries after battle as a form of redemption, not just for spiritual reasons, but as a way to step away from the chaos they had come to know too intimately. Religious orders across Europe were filled with former warriors who could no longer face the world of violence but didn't know how to live outside it. Alcohol was another form of coping. Drinking was deeply embedded in medieval military culture, not just for celebration or boredom, but as a way to numb memory and pain. It blurred the edges of nightmares and made it easier to ignore grief. In camps and after battles, men drank heavily, often together, and while this created problems of dependency and aggression, it also became a shared ritual, a way to suppress the unbearable through solidarity. But not all soldiers turned inward. Some became more violent, hardened by war, and unable to function in peace. Disfigured veterans, especially those missing limbs or carrying prominent facial scars, were often alienated from civilian life. Many turned to mercenary work, guard duty, or simply roamed from town to town. Some became feared figures in local taverns, resentful, unpredictable, physically imposing, men whose identities had fused entirely with the battlefield. Humor, particularly dark and morbid, served as an unspoken psychological shield. Jokes about death and dismemberment were common in military circles, not out of disrespect, but as a way to assert some control over a world where control was nearly impossible. Soldiers laughed about severed limbs or made mock bets on who would die next. It wasn't cruelty, it was survival. By laughing at the worst, they robbed it of some of its power. The camaraderie among fighters also played a significant role in resilience. Bonds forged through shared danger often became the strongest emotional connection in a man's life. Losing a comrade was devastating, not just tactically, but emotionally. And for many, those friendships were the only form of mental grounding they had. There were no spaces for healing, no therapists, no debriefings. If a man couldn't fight, he was often left behind. Psychological damage didn't count in the same way as a lost leg or punctured lung. It made men unpredictable, unreliable. Those who couldn't contain their fear or rage were quietly pushed aside, mocked, or feared. They were not treated. They were tolerated, if lucky, or forgotten. This was the human cost of surviving medieval combat, a body that could still march, but a mind left fractured by what it had endured. Number 6. Adaptation, recovery, and the luck of the times. In a world without surgical precision, antibiotics, or structured rehabilitation, survival after serious injury depended not on formal medicine, but on adaptability, chance, and the strength of the human body to heal itself under the harshest conditions. Once the chaos of battle subsided and immediate bleeding was stopped, the long road to recovery began, if the soldier was lucky enough to be alive. The first critical period was the first few days. If a wound didn't fester with visible rot or kill through blood loss or fever, then there was reason to hope. No one understood immune responses in modern terms, but experienced fighters and battlefield healers could recognize when the body began to close its wounds and regain strength. For broken bones, especially fractures caused by blunt weapons or falls from horses, splinting was common practice, though rudimentary. Straight sticks or boards tied tightly with rope, wool strips, or even gut cord could hold a limb in place long enough for bone to begin mending, though the alignment was often imperfect, leading to permanent deformities. Mobility was a luxury for the injured, and medieval craftsmen, especially blacksmiths and woodworkers, sometimes created basic aids: wooden crutches, single arm slings made from worn-out cloaks, or braces tied tightly around weak knees and ankles using strips of boiled leather. These devices weren't part of any institutional therapy, but rather the result of practical ingenuity and necessity. Many recovered soldiers learned to work around their injuries rather than overcome them. A man with limited use of one arm could still serve with a dagger or a club, or train others in drills and discipline. Some learned archery with their opposite hand, while others were posted on city walls or worked in positions that didn't require full mobility, such as gatekeeping, watch duty, or messenger work. Returning home didn't mean returning to peace. Villages and towns often lacked the resources to care for a non-productive adult male. But in tight-knit communities, family and neighbors occasionally helped those who returned disfigured. A limping veteran might still work a field slowly, tend livestock, or provide knowledge from his time in the army. Veterans of higher rank or those who had served lords directly were sometimes granted small plots of land or minor positions in local courts or guard units. These gestures weren't part of a formal pension system. They were favors, dependent on loyalty, social ties, and local politics. Monasteries played an essential, if limited, role in post-injury care. Religious institutions, especially Benedictine and Augustinian houses, offered shelter, basic herbal care, and a structured environment where wounded men could heal in relative calm. Monks and lay brothers treated wounds with poultices made from plants like comfrey, plantain, and marigold, believed to draw out poison and stimulate healing. Traveling healers and apothecaries also existed, though their reputations varied. Some genuinely knew herbal remedies passed through generations, while others peddled ineffective concoctions for coin. Still, in a world without formal medical licensing, people took what they could get. Recovery in medieval warfare wasn't measured by how completely someone returned to health, but by whether they remained useful. Those who couldn't adapt were often left behind by the demands of society, while those who found a new way to contribute, physically, tactically, or socially, carved out a second life from the ashes of their first. The unspoken truth was that survival beyond the wound depended less on medicine and more on timing, toughness, and the luck of who happened to be nearby when you fell.